Reactions over the KNH surgery mishap continue, with the chair for the National Nurses Association of Kenya, Alfred Obuya, now coming out to defend nurses who were among 4 medical staff suspended following the unfortunate incident at the country's largest referral hospital.
This issue of blame game that now is arising, that it was so and so, it was and so, I find that very, very simplistic and actually superficial. It is not addressing the real issue. If there's a surgeon or an anesthetist who was supposed to review his patient, let them not blame it on nurses if they didn't do that. Because the nurses don't review patients on behalf of the surgeons and the anesthetist. It is required that they must review a patient who is scheduled for surgery before the patient goes to theater.
Obuya termed it as frivolous attempts to absolve the surgeon from any wrongdoing, saying a surgeon is responsible for prescribing surgery and should therefore be held responsible in case of such an incident.
Everybody should carry his or her own cross. But the bottom line is that we are actually appealing to the Ministry of Health officials, top officials, to address the issue of shortage of nurses in the healthcare delivery system. If that issue is not addressed, even the issue of universal health care coverage that is a pillar within the Jubilee government today may not be realized.
KNH has been on the spotlight over the last few months with accusations of rape targeting new mothers at the delivery ward by hospital morticians, and most recently a case of a twin baby theft at the hospital. Following the latest incident, Kenyatta National Hospital CEO Lily Koros and Director of Clinical Services Bernard Gidai have been suspended.
The CEO of this organization, with the colleague responsible for clinical matters of this hospital, are sent on compulsory leave forthwith, and in their place 2 experts will be taken over to run this institution for the period the investigations will be done, and a decision will be reached following the investigations.
Health Cabinet Secretary Cicely Kariuki, who apologized to the family of the affected patient and Kenyans, directed the hospital's board to immediately undertake a probe on operations at the referral hospital. Caroline Kamara reporting for Channel 1 Weekend.